In the poster session tonight, we'll be presenting Duvelisib plus Venetoclax in the relapsed refractory population for the first time. This is an investigator-initiated trial that's led at Dana-Farber, where we're taking patients with relapsed disease and treating them initially with a week of Duvelisib, and then we introduce Venetoclax, ramped up. And so in the initial phase 1 portion, we were trying to determine what was the maximum tolerated dose of Venetoclax that we could safely give to these patients in this new combination regimen. We were able to safely get up to 400 milligrams, the standard dose of Venetoclax, given with Duvelisib. And so we've now treated 12 patients on this study. The toxicity profile has looked like the similar profile of the individual drugs so far. We have not seen any new toxicities arising. We've done some fairly careful pharmacokinetic evaluations to look for drug-drug interactions, and we've not seen any meaningful such interactions so far. And so this first part of the study has really helped us to identify 400 milligrams as the dose of Venetoclax to move forward into phase 2. We've seen promising efficacy data so far, with the caveat that we've only treated 12 patients, but even with that small number, we've seen complete remissions and undetectable MRD in the bone marrow. And so we're now accruing a phase 2 portion of this study, looking at a much larger number of patients to really pin down the efficacy of this doublet, both in CLL patients as well as a separate expansion cohort in patients with Richter's transformation. So we hope that this time-limited regimen with all oral drugs will be helpful for patients. We think that 1 year of therapy may be enough based on our data so far, but we obviously need to confirm that as we get larger patient numbers.